Hello, I'm Dr. Brandt Gibson, and I want to talk to you today about the bunion deformity. So what is a bunion? First things first, let's kind of show you. See if I got it right here. So a bunion is really that growth on the inside of the big toe. So what's actually happening in a bunion? The easiest way is to show you on a model here. So you got the foot, the bone should be nice and straight, but in a bunion, this bone tilts out, which causes the toe itself to turn in, which causes the bunion. And then what happens is you get pressure on the outside of that toe and you start to create extra bone or extra problems in that way. And it becomes a big deal. It becomes a problem where it starts to interfere with what you're trying to do. You say, okay, I'm now having discomfort. I'm now having rubbing on shoes, all those kind of things. Now, the things that a bunion is not. I've had people come in and say, okay, I've got a bump on the top of my toe. That's not a bunion. I've had people, when they've got the hammer toes where they're curling like that, they think that's a bunion. They also sometimes will get corns or calluses in between the toes. That's also not a bunion. I've had people come in and say, I've got a bunion, and it's actually a corn or callus. That's the issue. So a bunion is a growth on the bone caused by the first metatarsal turning out and the toe turning in, creating this prominence here. And this is a pretty significant bunion. Some people are not quite as bad. Let's go a little bit deeper here and kind of show you on x-ray what you're going to see. See, normally, if you look at that like that, that's the alignment of the second metatarsal. The first metatarsal is curved way out. It should be in line with the second metatarsal. So instead of being like this, it should be, instead of being like this, I mean, it should be like that. So it should make a difference. It should be nice and straight. If it were straight, then you wouldn't have a bunion, you wouldn't have the discomfort and so forth. And so most surgeries are designed to treat that, to try to adjust for that. So firstly, before we jump to surgery, what are some of the things you can do for a bunion? You can actually pad it. There's things you can do to put padding on the outside here so that you're not getting pressure on that bone. There's things you can do to put a spacer between the toes. So you put a spacer between the toes, it spreads them out, it straightens that toe back out, it takes some of the pressure off that retrograde bunion area. So let me kind of show you. So if you've got this tilted out and you got this tilted in, as soon as you straighten that out, it pulls that in just slightly because it's not pushing it out. So it's not having as much pressure and less problems that way. So padding, splinting it in a good position, putting a spacer between the toes can actually be helpful. If it's pretty painful, you can do cortisone shots to the area, although that doesn't treat the bunion. All it does is treat the symptoms. You can use anti-inflammatories. You can do arthritis creams, those kind of things on the space. You can wear wider shoes. A lot of times that's the first step people do. They say, well, it's starting to bother me in my shoes. I'm going to wear a wider shoe. It hurts less. But the only way to really fix a bunion is surgery, is to fix that bunion, is to actually do the surgery on the bunion. So what will be done if we were to do bunion surgery? The most common bunion surgery is a cut that we'll actually do right out there at the very tip of the bone here, in the metatarsal head. And what you're doing is you're doing a V cut through the metatarsal head. Let me slide this over here, and we'll switch to a line here so we can actually draw on this for you. What you're going to do is you're going to do a cut. Woohoo! What did I do? Sorry about that. I'm not sure what I just did. It actually yelled at me. Haven't had that happen to me before, but we will fix it right now. That's what happens when you're going live, right? So what you do is right here, you do a V cut through the bone. And what that V cut is doing is it's actually allowing us to take the bone and move it over. So if we bring it over here and you make that same cut, you make that V cut through the bone right here. And what you're ultimately going to be able to do is move that whole bone that direction. Now, in this case, this is such a severe bunion, this is not going to help because you can't move it so far to make this straight. You could move it far enough to actually make it, to be able to put this bone right here. It's just not going to work, right? You can't go that far over because you can only go about a little bit over that area. So in the surgery, we would take the bump off and then we'd cut through that bone like that, move the whole bone over. Sometimes when the bunion is severe, you may have to do the cut somewhere else in the bone here, or even at the joint area, especially if you got hypermobility where the bone's moving a lot. So you can do a Lapidus type surgery where you're actually fusing this joint with the bone straighter. You could do a cut somewhere in here, so you have a lot longer lever arm to make that straight, or you can do it out here. And there's actually options in the middle as well, which I usually don't do just for healing purposes. These heal quicker than this does, and then this does, of course. And so that's why a lot of times we'll do those instead. So a bunion surgery, so you're going to cut through that bone, and then you're going to move it over. And then what you do is you'll typically do a screw that runs right through this area. And what the screw is going to do is hold it in place while it heals. And ideally, bone heals in 6 to 8 weeks. And so it's stable for that period of time while you continue to do some of your activities, but you're still able to do some of the things you do. Typically, when I do the bunion surgery out there, I can actually let people walk pretty quickly afterwards in a special shoe or boot to allow them to function like they're supposed to, but it still allows it to heal because you get the screw in there that holds it stable while it's working. And then what happens, so if you actually say, okay, I moved this bone over and the bone's now sitting here, you've still got a prominence from the outside, right? So you're going to move that bone over here. So it's like right here. Then you take the remaining prominence off. And then what happens is the body will heal in this side and it will actually make it straight. So as you move that bone over, the body feels in the area and it actually makes it so this bone goes like, this bone actually will curve. It will be like this to be more straighter based on how you do it. So it'll be significantly straighter if you do it correctly. So the idea, a bunion surgery is a big deal. A bunion is a big deal. So if the bunion, it doesn't hurt you, and you say, I have that prominence, it doesn't look good, but it doesn't hurt. So you got this big prominence here, but it doesn't hurt you, it doesn't bother you. My recommendation is that you don't treat it. If it's causing pretty significant pain, it starts to interfere with life. That's the key factor. If it interferes with life, then you treat it and you fix the problem so you can get back to life and you can really enjoy your extraordinary life even with a bunion. Now, I do these all the time. This is a pretty common surgery. It's something you can actually get better at, but there are a lot of things that you can do. First things first, there's things you should try before you jump to a bunion surgery, unless it gets to the point where it's actually interfering with life and keeping you from doing the things you love to do. This is Dr. Brandt Gibson, and this is your Podiatry Tips Day 356. Yep, 356, bunion deformity and how you could treat it. If you'd like additional information, or you say, okay, I need a little bit more information on bunions, or I'd love to be seen and have my bunions evaluated, you can go to utahfootdoc.com and we can give you a lot more information on how to manage your bunions even before you come into our office. This is Dr. Brandt Gibson. Have a great rest of your day.